memorize the scoring system in pediatrics, especially there is three. Okay, Apgar scoring system, Silverman Anderson score, and Downey Vidyasagar score. Fine. So the Apgar, just remember one point, that Apgar, the R stand for respiratory effort. Okay, and rest of the chart you can remember. So okay, these all three scoring systems is never used to guide neonatal resuscitation program, never for resuscitation. They just used to predict severity and mortality. Apgar system, you have to memorize each and everything. Means A for appearance and the value 0, 1, 2. But in Silverman Anderson score, okay, and Downey Vidyasagar score, just memorize its parameter. No need to remember everything. Fine. Okay, in Silverman Anderson score, the parameter are, there's three retraction: upper chest retraction, lower chest retraction, and G5 retraction. Since it's retraction, there will be grunting, and it's expiratory grunting. Fine. Plus there will be nasal flaring. Excuse me, nasal flaring. In Downey Vidyasagar score, the parameters mnemonics is CR का गाढ़ा. CR means cyanosis, R for respiratory rate, respiratory effort, fat. It's only for Apgar scoring system. Fine. And G for grunting, R for respiratory rate, definitely A for air entry. Just remember the parameter. Okay. In AIMS, in the history of AIMS, okay, they have asked only one question of Silverman Anderson score, and just they give the video and ask to calculate the Silverman Anderson score. So for just remember the answer of this question, they will give this question only if they want to give. So they will give a video and ask to calculate the Silverman Anderson score. Just memorize it answer. Its answer would be 8. That's enough. Fine. Okay, all the scoring system, okay, have we give the value with 0, 1 and 2. Never start with 1. Okay, scoring system, either Apgar or Silverman or Downey Vidyasagar, the value always begins from 0, then 1 and 2. But staging, for example, sarnat and sarnat staging, and it's all of the staging, necrotizing enterocolitis, Bailey staging, they all begins from stage 1, 2, 3. Okay, now in sarnat and sarnat staging, fine. 1, 2, 3. In 1, the baby is hyper alert. Since baby is hyper alert now, so definitely there will be mydriasis and strong moro reflex, because baby is hyper alert. In stage 2, there will be seizure, and this is a buzzword. If they ask, they mention the question, it's a seizure, so it's definitely a HIE stage 2. Fine. Okay, this seizure is detected on low voltage EEG. Okay, in stage 1 is a mydriasis, so in stage 2 there will be meiosis. In stage 1 there is strong moro reflex, so in stage 2 there will be weak moro reflex. But there's one thing common between stage 1 and stage 2, that is deep tendon reflex is increased or exaggerated in both stage 1 and 2. Fine. And in stage 3, the isoelectric EEG will show burst suppression, okay, like this graph, or it will be isoelectric line, flat line. Fine. And there will be no deep tendon reflex, okay, and no moro reflex. Stage 3 will be no moro reflex, no deep tendon reflex. For all the scoring system, the value will start from if 0, 1, 2, 3, 0, 1, 2, 3, 4, 5, 6, 7. For Apgar scoring system, Silverman Anderson score and Downey Vidyasagar score. Okay, for 0, 1, 2, 3, the value is the score is low, and for 4, 5, 6, the score is intermediate, and lucky number 7 or more than that, the score is considered good. If for all, okay, for Apgar, Silverman and Downey Vidyasagar. Fine. Okay, so if it is low, that means child is having severe asphyxia. Okay, Apgar score is done in all neonates, what is healthy or unhealthy, is done at 1 minute, 5 minutes in all baby. Okay, if you suspect he is suffering from asphyxia, then do it also 10 minutes, 15 minutes, and you can also do 20 minutes. 1 minute score is least sensitive score. Okay, Apgar score can be done for healthy and unhealthy, and this unhealthy baby can be term and preterm. But if you look the Silverman Anderson score is done only for preterm baby, and Downy Vidyasagar is done only for term baby. Okay, but Apgar can be done for term and preterm. Second thing, let's talk about kernicterus. Kernicterus is basically a complication of jaundice, and it is seen due to the deposition of unconjugated bilirubin, indirect bilirubin, okay, in brainstem and basal ganglia. Since brainstem there are lots of nuclei, for example third nerve, so there will be upper gaze palsy. Basal ganglia is affected, so definitely there will be movement disorder, choreoathetosis, balismus tremor. But brainstem and this basal ganglia are affected in late stage, okay, late stage of kernicterus. In early stage or acute phase, the baby will have low muscle tone, hypotonia. So since the muscle is hypotonia, the buccinator muscle are weak, so baby cannot suck the milk, so there will be no poor sucking, so there will be lack of glucose in blood, that is child suffer from hypoglycemia, so child suffer from seizure. So in early phase acute condition, there will be hypotonia, poor sucking, hypoglycemia, seizure and stupors. But in late phase, since basal ganglia is affected, there will be movement disorder and cranial nerve are affected, especially 8th nerve and nerve supplying to eye muscles. So 8th nerve is damaged, so there will be a sensory neural hearing loss. And since the LR6SO4, this oculomotor nerve are also damaged, so specifically more specific will is in upward gaze palsy. Fine.